this video, I'm going to cover a model of degenerative disc disease. I'm Sebastian at Performance Place Sports Care, part of the locally world famous chiropractors in Costa Mesa, California. I thought I would cover this model today in a little bit more detail because many of you have had MRIs and X-rays done and you're not quite sure what all these big words mean. I know a lot of people will look these words up and they see a lot of scary things and feel that they have a disease that they'll never recover from, and that's quite untrue. A lot of the problems that you'll find in the image are not necessarily the symptom generator, okay? I'll bring that up again in a little bit, but before we get too far, I'll make sure to cover this model and make sure you guys understand anatomy of a section of the lower back so you can relate it to some of the imaging and the reports that you have. By the way, if you guys are looking for any help at any point, you can always find us in our link description below. We see people virtually and in person, and we do have a webinar up in the corner as well that covers lower back pain. Okay, so I'm going to do my best to get this thing as super close as I possibly can to make sure our camera takes focus of it. We've got this high-def camera that should keep everything nice and crisp for you. Okay, so this is part of the low back. We can call this probably L4, L5. Many of you have been told you have L5, S1 problems, but we don't have a sacrum on here, so this is going to be L4, L5 for argument's sake. This is the back of the spine, and this is the front of the spine, all right? If I'm looking head on here, this is going to be your left side and your right side. Okay, if we look from the bottom, you'll see this is the back of you, like you're laying face down, and this is the bottom part of you, which is basically your belly on the table. Okay, and then we have, this is your spinal cord. Here's all your little rootlets. The rootlets are part of the very end of the spine. All right. Sometimes people will be looking at these things for conditions called Cauda-equina syndrome. If you've been told that you may have that, we're looking at some of these rootlets. Okay. Now, if you were to actually feel the back of you, the back side of you is here. These are the bones just between your muscles. All right. You can probably feel them. You'll feel one guy sticking up right here, and then it'll sink into nothing. And you'll feel this guy here. It'll sink into nothing as well. And then there's a gully behind it here, which is where a muscle sits, like the multifidus, the rotatory muscles of the spine, and so on. And so that's where all the muscles sit, right into there, at least for those smaller muscles of the spine, okay? Now, if we look at this guy, this is the transverse process, these are the spinous processes, and there's ligaments that go all over these areas as well, okay? Now, this is the nerve that comes out. This is one of the spinal nerve roots, all right? The spinal nerve root is the nerve that supplies the nerves like the sciatic nerve, the femoral nerve, and some of the little nerves that are actually into your leg. Actually, all of the muscles of the lower leg or of the leg are supplied by nerve roots of the lumbar spine, and then they converge into becoming the bigger nerves that you may be more familiar with, okay? And so this is the intervertebral disc. Your MRI or X-ray may have commented on disc height. This has a shortened disc height. It should be maybe a little bit larger, all right, a little higher, a little bit more cushion between the bones themselves. But overall, it's not fully collapsed either, all right? You can actually see here that light casts a nice shadow, actually, right into this area, and you can see all these little jagged points along the side of the top part of the lower vertebral body. And so this is a little bit more of an arthritic formation. This is bony formations coming off of the end plate. Some of your MRIs have been mentioned end plate. They've mentioned bone marrow. Bone marrow is on the inside of these guys that we can't see, and so on. There's also the areas where the nerve roots come out of, which is called the foramen. Your X-rays will look like this, your MRIs will look like this, but also they'll look like this too, okay? And when they look like this, we're looking to see if, and we can't see the disc in this part, we're looking to see if anything, including the disc, has moved back into the canal where this spinal cord is or where the nerve roots exit into this little region, this little recess. Again, this is called the intervertebral foramen, okay? Now, some things will actually grow into the foramen from a bony standpoint, and you can see it actually on, this top one's a good one to see. So you see this guy right here and this guy right here? As I turn in, you'll see that I put them in front of my face, they don't really look the same, okay? That's because one of them, this guy, is generally normal, and this guy is abnormal. It looks like he's had to do a lot of work over the years, and so this one almost looks like the top of Groot's head, you know, in Guardians of the Galaxy, and this guy looks like it's a little earlobe, right? Groot's head, earlobe. And so this is a growth of bony formation and osteophyte growth, which is coming off of, in this case, it's the lower half of the facet joint. The facet joint itself is right into here. This is the lower half. The top part's been removed, just so you can see. And this is the lower half of the joint. And down here, we have another one, another facet joint. There's a lot of facet joints in your spine. You can actually see right here, there's a little line right there. That represents the joint itself, and that's spacing between the joint. So we have this one, which is also overgrown quite a bit, just like this guy. And it makes it so this joint is a little bit altered in its mechanics, and sometimes this joint can create some pain as well. Now, what goes along with this too is that guy, that little Groot head, can grow into the hole here, which would be foraminal stenosis. And if we look at this other side, with the more earlobe head, it has more space. I can stick my finger kind of in there. While on this side, again, the Groot head has grown in and there's less space overall. And so when there's less space overall, sometimes that can create pressure on the nerve root, almost like a tourniquet, and it makes the nerve root swell. When the nerve root swells, it has different physiology attributes to it, and also it can become really sensitive to pressure, even pressure that it's normally okay with, and it can also become intolerant to stretching, like some of the tests your doctors might have done with you. Now, overall, there are a few more things they mentioned. I'll show this one last. This is this is an enlarged ligament of flavum, right into there. All right, it's between the vertebral or the kind of the roofs of the house here, or right underneath the spinous process. And actually, it's an interesting structure. You can barely see it in there. It's kind of translucent. And so if I extend this spine like you're arching your back, actually it will bow itself into the canal this way, which will create a little bit of pressure on the spinal cord as it passes through, and it creates a little bit of pain as people arch their back. So as you can see, there's a lot of complexity to the spine if we really go deep down into it. However, the good news is that even if you have like the Groot head, or you have like a little bit of flattening into here too, there's still hope for you. There's still things that you can do. And rehabilitation tends to work really well if you do the right things. None of the exercises you're doing should really hurt. They all should just feel they should feel challenging, but they shouldn't increase any pain really in any way. And so there's this kind of mindset where people tend to fight through the pain. They say no pain, no gain. They're trying to make it so their back works well and feels good again. That's not good. That's not right. If you choose the right exercises, choose the right hardness of exercise, and it's coached well, they won't hurt. You'll only feel better. You'll feel more supported, more stable at the end, and your back will feel less tweaky, less pinchy, and so on. It even works for things like sciatica. Now, if you guys are looking for help, we can help you. We're in Costa Mesa, California. We do virtuals and in-persons. We see people virtually through the computer, and we coach them in the right exercises to do. We see people all over California, and it's been really, really good, even when they have even the most disheartening cases. So if you feel like you've given up and you feel like there's nothing that you can do for your low back, reach out to us. We specialize in low back pain, hips, and groins. I think we do a very good job at it, and we'd love to help you out too. So the link is in the description below. Just set up a consultation. We'll be right there to help you out. And on YouTube, at least subscribe to us and follow us. We have lots of videos on degenerative disc disease right on here. We'll see you next time.